Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription. Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome to Medicare Moments with your host, Toni King. Hi, Toni, and Happy New Year.
And how are you doing, Jim? I'm having a good time. It's been a good New Year's Eve and good New Year's Day over here. I'm very proud.
And this is our first podcast of 2025 recording.
That's right. And it's an important recording because it can affect a lot of people nationwide.
Toni, you have a question from Tanya in Galveston, Texas, who says, Dear Toni, in December 2016, you assisted me and my husband, Gary, in leaving my employer's benefits. We enrolled into Medicare Part B with a Medicare supplement and Part D prescription drug plan, all beginning January 1, 2017. The 2024 Medicare annual enrollment period is the only year that we have changed from the original Medicare Part D plan that we enrolled in for 2017, and both Gary and I have recently received invoices by mail from the $0 premium Part D plan. Gary's payment for 2025 is $110.40, and mine is $344.40. I don't understand why we don't have a Part D premium that was stated on the Medicare.gov website as a $0 premium for the same Part D plan that we enrolled in November 2024 for 2025. Please explain what our Medicare Part D issue may be. Thanks, Tanya in Galveston. So what do you have to say, Toni?
Well, the thing that I have to say is this is really a Toni Says client. I helped her literally enroll in December of 2016, leave their company insurance and enroll in a brand new prescription drug plan with Part B and the Medicare supplement. And she had a premium for her prescription drug plan, which came out monthly. She should have gotten a letter from the prescription drug plan that she signed up for, and she never changed until this year. And I've just enrolled her in a zero premium Medicare Part D plan, the same one that you and I are both on. And because it's zero premium, they sent her a bill. And she was shocked to find out that her husband's is $110.40. If you take it monthly, that's $9.20. Hers is $344.40. If you take that monthly, that comes up to $28.70. That's always been added to that prescription drug plan. She never got a bill from the beginning. And whether she got her LEP, what they call late enrollment penalty letter, nobody knows, because it was from December or January or February in December of 2016, January or February in 2017 when she got the letter. She today went down to the Social Security office. She's got to show that she's came off her company insurance, and Social Security has a copy of the forms. She does not know where her CMSL 564 is, the request for employment information. There was a 6-hour wait at the Social Security office in League City today. So all I can tell people is that when you're coming off your company insurance and you're past 65 and 90 days, number one, put the papers somewhere important where you put your marriage license. You got all your important papers. Put those papers with you because you may need them. She needs them now. So she's got to get the copies from Social Security. When we called Medicare before Christmas, Medicare could only go back to 2022. She started in 2017. So Medicare they could not find anything. They said, you got to go back to Social Security. It's a ball game. So because she's having that issue, I'm going to help her file reconsideration forms with Social Security. They may have given her the Part D penalty and never sent her the letter. So you got to be real careful when you're coming off company benefits past 65 and 90 days that you keep all the forms. You know what you're filling out. And a lot of people never even look at their mail.
Well, you're right. You and I had this conversation the other day that people don't all look at their mail like we used to, right? We don't look at it. And then people don't always look at their checking account to see what's being deducted from their checking account. They may set it up once or whatever and not really do a deep dive into it to see what's going on. So you're right. And keeping paperwork for your Medicare life, which I think is really important, your Medicare life, as you call it, Toni, is really important so that you have these documents, because you can't depend on the federal government to keep them, because as you said, they only go back to 2022?
And they should go all the way back to when Medicare got started in 1965. You would think the government would have copies of all the papers, but they could not find it because of everybody counts on your computer now. And she's going to have to find it to appeal these premiums. Number one, she has to pay the premiums now, and it may take us how long to get those premiums taken away, to get it corrected. So she's got a little battle to do. And if she can't get this solved by going to the Social Security office, then she needs to call her congressman, because he can go directly to Social Security and pull the forms.
Well, it's important that she has Toni King on her side. You're listening to Medicare Moments with your host, Toni King. Medicare Moments, one of America's top Medicare podcasts. It's new every Wednesday morning, and we'll be back with more right after this.
Hi, everyone. Super Bowl champ Vernon Davis here from Legal Help Center. If you've been injured in an accident and think you deserve compensation, listen up, because we have legal professionals standing by right now to answer your questions for free. You can find out if you have a case and how much it's potentially worth.
Thanks, Vernon. You heard it, folks. If you've been injured, call and find out how much you qualify for. Call 800-497-4410. Advertisement sponsored by Legal Help Center. May not be available in all states.
Okay, Toni King, Medicare Moments is the podcast. You're the host. It's a brand new year, 2025. We've seen lots of changes going on, and you're involved with trying to help Tanya. And you were mentioning before that she may have to go to her congressman, right? In order to get this done. And so do you do that for someone, or does she do it on her own, or how do you work that out?
She has to do it on her own. Okay. You have to, due to confidentiality, you have to do it on her own. But she did not know that she had past premiums, that she was getting that LEP, late enrollment penalty, until she got a 0 monthly premium for the prescription drug plan that she enrolled in. Had no idea of this. And now she's just beside herself. She was 70 when I first helped her enroll in Medicare, and now she's 80. And working with computers gets them confused. So what we had to do is, number one, I had to call her old prescription drug plan to verify that she was being charged the LEP, the late enrollment penalty. And she was. I did call, because I'm the one that enrolled her in the prescription drug plan. I'm not mentioning names because I don't want people to think, oh, that prescription drug plan is not any good. That one's not any good. That has nothing to do with it. This is how the game is played. And don't wait more than 63 days when you get the forms to let the plan know that you just left your company insurance and you had credible coverage for your prescription drug plan. People think that the creditable coverage means that you have good insurance. No, it means that your prescription drug plan is as good as what Medicare has or better. And so she met the need, but we don't know whether the forms were ever turned in. So she's got to go and do a reconsideration appeal with Social Security to get that penalty taken away. And this is going to be a big game. And I love games. I have no problem going and fighting Medicare or Social Security to make sure something's done right. This is not the first time I've done that. And so she's going to appeal it. And you've got to be sure that you do turn those forms in no longer than 63 days from when you come off your company insurance. That's the time that Medicare gives. But I think they're noticing that there's a lot of mistakes because it wasn't anything for that girl with Medicare says you need to call Social Security. So they must be getting a lot of phone calls right now.
Well, and one of the things we say a lot, you do, Toni, is that Medicare is confusing and what you don't know can hurt you. And here's a situation where, Medicare, it is confusing, but keeping documentation, and not a lot of people do that. People move, they just don't look at their mail, like you said, or other things. So what's your advice for our listeners is keep your records somewhere where you can get them, right? And also make sure that you check what you're paying and do that within the 63-day window that you just mentioned.
Correct. She was letting her husband take care of this part of Medicare, and she had no idea what was coming out of his checking account. He looks at his, she looks at hers. Different people have different rules in their family.
They do.
Oh, yeah. And, we had Hurricane Harvey here. People's houses flooded. They lost all their paperwork inside their house. So we never know. Sometimes if you've got important documents, put them in a plastic bag or stick them in the freezer. That's, where are they going to go? Nowhere. Right. I mean, that's advice what they tell people.
Good advice from Toni King on this edition of Medicare Moments.
Yeah.
Toni is here for you. Toni is America's Medicare coach. And Toni, as we wrap up this podcast today, let's just tell the folks that you have a website, tonisays.com, TONISAYS.com. Lots of people visit it. On that website, Toni has a lot of resources that will help you through your Medicare life.
And coming soon is going to be my new Medicare Survival Guide that is going to discuss Inflation Reduction Act and all the changes that are going on. So people need to get themselves ready because Medicare is fixing to change. Things are going to be big this year and next year is what I'm seeing. So they can contact me at info@tonisays.com. They can give us a phone call at 832-519-8664. And they can go online. We've got the video series. We're going to have our new YouTube channel. We're ready to rock and roll, aren't we, Jim?
We are, Toni King. We are. So thanks for joining us for this edition of Medicare Moments. And Toni, back to you as we say goodbye.
Well, I just want to thank you, Jim. And we got a new year, and 2025 is going to be fantastic. Don't you think?
I'm with you.
Okay. We'll talk to you later. Y'all go have a good day. Bye.
It's time to rethink, renew, and reimagine retirement. Hey everybody, Jared Sebesta here, host of Retire Repurposed. Now this podcast is about the non-financial parts of retirement, which many times can be even more challenging than the financial. We believe retirement is not the end, rather the beginning of what could be the most impactful, purposeful, and fulfilling season of a person's life. So don't retire, become repurposed. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.